Hi everyone, so today we're going to be talking about yeast infections and how we can treat them over the counter. So not every itch, not every odor, not everything that is wrong with our lady parts are because of yeast infections. So we're going to break it down, define what yeast infections are, the symptoms of yeast infections, how we can treat them, and how we can prevent them. Yeast infections are a type of vaginitis. So the vagin is referring to our lady parts, and the itis is referring to inflammation. So usually when we're talking about any itis, it's usually about inflammation of a body part. So remember that song that talk about elephantitis? Elephantitis is because the leg or the body part looks swollen like an elephant, or it's inflamed like an elephant. But we're talking about our lady parts now. So vaginitis is because our lady parts are inflamed. So we have different types of vaginitis. Candida, which is doctor's talk for yeast infection, is caused by a fungus, in case you didn't know. And no, I'm not talking about the yeast that you use to bake bread, although they're both fungi. Our skin, including our lady jewels, every day it contains bacteria, fungi, and viruses. However, when something triggers them to overgrow, then it can cause an infection. This infection can either be a bacterial infection, a fungal infection, or a viral infection. But today, we're going to be focusing on a fungal infection. An infection is when the germs grow out of control and it starts to have a negative effect on the body. Now, back to yeast infections. The fungi Candida lives all over our bodies, including our scalp, our skin, our throat, our mouth, our gut, and our private parts. So they're literally everywhere. For our lady parts in particular, if the environment inside of it changes, it may trigger the fungi to multiply, which then can cause a yeast infection. Now, what can cause a fungus to grow out of control? So some of these environmental changes can be pregnancy, diabetes, taking antibiotics, using contraceptive pills. It can occur after a period. It can also happen using personal lubricants, spermicides, and sometimes ins and out activities that happens between partners in bed, or simply having a weak immune system. So fungus, whether it is a mold on your bread, which is a type of fungus, it likes a perfect environment. So once the environment is perfect, it's going to grow, it's going to multiply, it will cause an infection. And what is a perfect environment? Moisture and warmth. So what are the signs and symptoms that you may have? Now I should point out that infections of our special area share the same symptoms as a yeast infection, and their treatments are different. Let's think about it. So if it is a vaginal bacterial infection, we won't treat a bacterial infection the same way we will treat a fungal infection, nor will we treat a fungal infection the same way we treat a viral infection. That's just not how treatments work. We have to be specific and deliberate with how we're treating it. Using a list of symptoms to diagnose your condition is not advised. A doctor, after inspection, will better be able to diagnose your condition. But here are some of the symptoms you may experience if you have a yeast infection according to the CDC. Vaginal itching and soreness, pain during intercourse, pain or discomfort when urinating, abnormal vaginal discharge. Some women can develop severe infections that involve redness, swelling, and cracks in the wall of our lady parts. Before we go any further, I just want to clear up any misperceptions of where our vaginas are. It is not the outside of our body, it's actually on the inside, the same place where you'll put a tampon if you're menstruating. Here are some options. So we're only focusing on over-the-counter treatments for yeast infections. In the US, over-the-counter treatments include clotrimazole cream inserts, clotrimazole pessary inserts, Miconazole cream inserts, and pessary inserts, and also Tioconazole cream inserts. In Jamaica, as of January 2021, we do not yet have an over-the-counter treatment for yeast infections. However, a handful of pharmacies do stock Monistat, which is an over-the-counter option. The Miconazole cream can be used to treat the itching that you may experience on the outer lips of our lady parts. We do, however, have a clotrimazole cream that can be used to treat the itching over the counter, to treat the itching that you may experience due to a yeast infection. Here's a side note. The CDC advises the unnecessary or inappropriate use of over-the-counter preparations is common and can lead to a delay of other vulvar vaginitis etiologies, which can result in adverse outcomes. So essentially, if you have bacterial vaginitis, non-infectious vaginitis, or trophic vaginitis, you could be incorrectly treating them with antifungals. When neither of those infections are fungal in nature and will never go away no matter how much of those antifungals you use, and could wreak havoc. Mind blown. If you do use an over-the-counter treatment without being diagnosed by a doctor and you realize that you're not getting any better, I would recommend that you do see a doctor to get properly diagnosed and properly treated. A minor advisory: these creams and ovules are oil-based and can weaken latex condoms and diaphragms, which means if you weren't planning to grow a family, use extra precautions or simply abstain. So yeast infections can be preventable. You can follow what your mother said about wearing cotton underwears, because cotton is breathable unlike synthetic materials. Avoid wearing synthetic tights and underwears every day for long periods. Another way to prevent it: only take antibiotics when your doctor prescribes it for you, and take the antibiotics when finished, unless you're allergic to it. So let's go through that again. So a yeast infection is a fungal infection. It can be prevented. It's treatable by using over-the-counter options like Tioconazole inserts, Miconazole inserts, and clotrimazole inserts. I should point out that in Jamaica, the clotrimazole inserts are not yet over-the-counter. So we're pretty much limited with how we can treat our yeast infections. However, I would advise again, go to a doctor, get diagnosed, get treated, and get better.